Hello, today's video topic is does piles cause weight loss? This is a very interesting question because most of the people ask us. Generally or even normally, piles cannot cause weight loss, but indirectly it can to an extent. See, as in the previous videos, we have seen the root cause for piles or any other bottom problem like fissure, fistula is constipation and obesity. So people who are constipated, generally if they look at their diet part, they'll have more of carbohydrates and less of fibers. When they have piles, they themselves know, or even the doctors will advise them go for fiber-rich diet and to cut down the carbohydrates. So when they change their diet pattern and more of fibers, they can lose weight, a little bit of weight, maybe a couple of kilos, not more than that. Same way, when they are obese people, when they're constipated and they change their lifestyle and they change your food habits like less carbohydrates, more fibers, and if they do exercise as per the doctor's advice, they also can lose weight, and it will be little more for them because the initial weight, obesity weight is very high, so they can lose little marginal weight loss. This is one way of looking at. The other way, the doctors, when a patient with piles loses weight, and they will think, we think in a serious way, because usually piles, the weight loss may be 1 or 2 kgs, not more than that. That too because of the diet change. But if a person thinks he has a piles and the weight loss is huge, like 5 kg, 10 kg, with a loss of appetite, then we have to think in a different way. It could be sometimes a tumor, a growth in the rectum or anus, or even in the colon. So usually piles doesn't cause weight loss, but it can to an extent, like maybe 2-3 kg, because of the diet changes, food discipline, and lifestyle changes. But if you think you have a piles and you're losing weight drastically and with the loss of appetite, then you have to think, you have to really seek the help of a surgeon to look inside. Either he may ask for a colonoscopy to rule out the tumors. We all know the piles, because of the bleeding, they may be anemic, they may be tired, but if the weight loss is there, we have to think we have to give little seriousness to that. And most of the time when the piles get complicated, like thrombosed, or because of the pain, people will always, piles patients, they always fear of going to the toilet, fear of passing motion. So the fear itself make them to eat less, because if they eat less, they do not pass motion, so the pain will not come back. So they, out of fear, they stop taking normal diet, and they reduce their quantity so they can lose weight. And the same way, if the piles complicates with the fissure, because of the constipation, piles and fissure comes, and again pain, so they always fear of the pain stops them eating a normal diet, so again they can lose weight. But whatever it is, piles only to an extent can cause weight loss. If the weight loss is very high, very drastic, and coupled with bleeding and loss of appetite, immediately seek the help of a surgeon. He will examine and he will rule out the worst part, like the tumor. So piles generally doesn't cause weight loss. Thank you.